Welcome to the DisabiliTEA, a podcast where we have candid discussions about all things related to disability. Short-term, long-term, financial claims, impact on other areas of life, causes in the workplace, and more. With your host, attorney Anjel Burgess. You can find this show at www.disabilityhelpline.com and on YouTube, Facebook, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Now here's the host of the DisabiliTEA, Anjel Burgess.
Hello, everyone, and welcome to another episode of the DisabiliTEA. Today, we are so excited to have with us Symantha Reenders, who is a physical therapist. Welcome, Symantha.
Thank you.
We are so excited to talk with you today and to learn more information about physical therapy. So the first question that I want to ask you is, please tell us what the letters mean after your name.
Well, the PT just designates that I'm a certified physical therapist or a licensed physical therapist.
Okay.
The DPT means I've completed a doctorate in physical therapy. It's a clinical doctorate. When I graduated from physical therapy school in 1998, it was right before that program turned into a doctorate degree. So I actually had to take some extra courses soon after that to get my the DPT added on.
Okay. So do you prefer to be referred to as Symantha or Dr. Reenders? How should we address you?
Most of us physical therapists are pretty informal.
Okay.
So we typically just go by first names.
Okay. All right. Wonderful. Well, I want to talk about physical therapy and what it is that you do, if you'll share that with the audience.
Sure. So I'm a physical therapist at Northside in Forsyth, Northside Hospital Forsyth, and I'm in their outpatient clinic, which means that I treat people. They come to me from their homes or assisted living centers or wherever. They come to me, so they're able to get out of their homes, whether it's in a wheelchair or on their own 2 feet or whatever. But they see me for rehabilitation purposes, to gain strength or balance or improve their ability to walk or improve their ability to get back to work, whatever that may be. It's a pretty wide variety.
So would you say that your typical patient is someone that has sustained an injury, been in a car accident, or do you help or see patients that have more chronic conditions?
We see a lot of both.
Okay.
I do specialize in rehabilitating people that have had amputations. And I would say probably the majority of them are due to trauma.
Okay.
From like a motorcycle wreck or a car wreck or a boating or train. I've had all kinds, or, farming accident, things like that. But there is, amputations can be caused by medical occurrences as well.
Right.
Blood clots or, diabetic issues, things like that, or cancer. I get quite a few, our osteosarcoma is a pretty common diagnosis that will lead to an amputation. So it's a pretty wide variety of backgrounds. Now, I do see people that have had strokes or Parkinson's or, I forgot the timer on the light. I'm so sorry.
That's okay.
Parkinson's, we see a lot because we are connected to the hospital. So we get people that have had any variety of medical issues, and they've just gotten weak. Maybe that the medical issue doesn't necessarily mean that they need to go see a physical therapist, but the fact that they had to stay in bed or stay in the hospital so long, and now they're so weak that they cannot, go back to doing their daily activities well or without help, then they would come to see us.
Okay. All right. So you are just trying to help people restore their mobility, their ability to just do the day-to-day things
Right.
that they need to take care of themselves.
Right. Sometimes it's as basic as being able to get in and out of bed by themselves, or go to the bathroom by themselves, feed themselves, and then oftentimes it's getting back to work, or getting back to a sport, or getting back to something that improves their quality of life.
Excellent. And so I know that you're at the hospital, so I would imagine you get your share of patients that come in through the hospital, but do you have people that will just see you kind of, on an outpatient basis where they come in and, they get their treatment and then they're able to go back home and resume their day-to-day?
Yes, yeah, we get a lot. In the state of Georgia, we do need a doctor's referral. It can be from any doctor. It can be from primary care or a specialist, or a pain doctor. It can be from any of those doctors, but we do need a doctor's referral. And then they just call the front office. The front office will verify their insurance. And if someone doesn't have insurance, there are options for those folks as well. Northside, and I think most hospital systems are pretty good about providing some sort of financial assistance if needed. And then we can see someone. So they don't have to have been in a hospital to come.
Okay.
So if someone just has an issue or an injury, or life happens and they just feel like they've gotten weaker or their balance is worse, they can just let their doctor know and get an order and then get that set up and see us.
Okay. So when that's really good, because what comes to mind, I know a lot of people when they hear physical therapy, they think of like some sort of maybe acute injury, car accident, things of that nature. But for people that have more chronic conditions, maybe even arthritis, or they're dealing with an autoimmune disorder,
exactly.
They too can get physical therapy and get some help with just kind of restoring their quality of life, is what I'm hearing from you.
Right. Yep. That's exactly it.
Excellent. So are there any, for people who are listening that may have chronic conditions, are there any diagnoses that that your patients commonly have that you can just kind of share that, hey, you could benefit from physical therapy also?
Yeah, there are a lot, like I mentioned earlier, neurological diagnoses like Parkinson's, that more and more people are getting diagnosed with that and at an earlier age, and are still trying to work and function and raise kids with Parkinson's or MS. There's a lot of really unknown autoimmune disorders, like you mentioned, that cause decreased function. So we do treat, I'm always learning about new names of autoimmune disorders, with patients that come in here. And then it's just general, I can't tell you how many people we had come in after people started going out after COVID, just not getting out, not going to the gym, not going out to exercise, not going to the stores. People didn't realize until they started trying to go back to that stuff, how weak they were and how deconditioned they were. And that when they go to their doctor and complain, and the doctor's like, well, go to therapy. Let's give you a jump start to get back into the gym, back into your exercise routine. And then, that just helps overall quality of life. And that helps all other kinds of health factors, your cardiovascular health, lungs, your brain. Exercise is one of the best things you can do to maintain brain health and memory. So, we see a lot of different diagnoses.
And speaking of COVID, have you seen a just kind of surge in people that have, COVID long haul, that have not been able to recover since having COVID?
Yeah, we have. And we've seen some interesting neurological issues from long haulers COVID. Really, really off the wall stuff. But people are slowly getting better, but it has taken a lot of therapy to get them back. It's really interesting.
So I'm sure that, everyone's recommended course of therapy is different, but if someone is going to get physical therapy, let's say they are having issues with mobility and they're seeing a decrease in their ability to kind of get around and do the things that they need to do, can they expect that physical therapy is something that they will need to go to frequently, like several times a week typically, or does it just depend?
Typically what we do is like a 2 to 3 times a week for 6 weeks, and then we reevaluate and determine then if, if they feel like they're comfortable then to continue on at a gym or on their own at home, then they can give that a try. If it doesn't work out, they can always come back. They can get another referral from their doctor and come back for a tune-up.
Okay.
And that's fine. Most insurances will cover that. There are a few insurances that are difficult to deal with, but most insurances will cover stuff like that. Yeah, that's not uncommon.
Okay.
And there are rare cases where we'll see people more frequently than that, but that's rare. Like if someone's had a surgical procedure where the surgeon's protocol wants them to come in here 4 to 5 times a week, then we do that. But that's unusual, and that's more like a post-op.
Okay.
And it might be like for every day for 2 weeks, and then we back it down to 2 to 3 times a week.
Okay. But the more typical is going to be 2 to 3 times a week.
Right. Now, we do have people that they just can't make it that often. They have to rely on rides or transportation, or maybe they have a copay they can only afford once a week, and that's fine. We work around that the best we can, and try to give home programs to those folks so that they can continue it on their own in the meantime.
And that's a perfect segue to what I was going to ask you about, our home programs. With each patient that you see, is there some component of their treatment? Like, let's say they come in, they see you twice a week for 6 weeks, but is there also some component of that treatment that they have specific exercises that they need to do at home?
Yeah, absolutely. And that is a big part of the therapy. Is getting the goal is to not have to come to therapy forever. The goal is to be able to get back to the things you're doing, or as close as you can, to maximize your functional mobility, but then also have a really good set of exercises or a good program that you can continue on your own.
Okay.
And maybe it's at a gym, maybe it's at home, maybe it's outside, and then maybe I have people that I might see like once or twice a year for just a few visits, just for that tune-up, like I said earlier, just to maybe update their home program, or maybe they've decided that this isn't really working that well anymore. Maybe I need something more challenging, and then we'll work on that for a few visits, and then they go on again on their own. Okay.
All right. That's really good to know that there is. It's just as important to do, the exercises at home as it is to do them when they're there with you.
If not more important.
Okay. Because
that's what's going to keep you feeling better and moving better, is getting in a routine of doing some sort of exercise, 3 to 6 days a week. You just have to keep moving. Movement is key.
And you brought up something else that I know that I've heard in the past from clients that don't have the financial means for therapy. And I know I've seen situations where a lot of times there may be a surgery, right?
Right.
And following the surgery, they are not able to afford physical therapy. Would you recommend that, if you can at least get in once, to just do what you can, but make sure that you can get in to get those exercises, to learn the things that you need to do to help with their recovery?
Right. Yeah, I do, because that is so important. Because if you're just to at least have someone get eyes on what you're doing to make sure you're doing them correctly, because you can damage a surgical procedure by doing exercises incorrectly or going back to doing something too soon. And then you can end up in a worse situation than what you were pre-op. So it is really, really important to at least get 1 or 2 visits in, just to get eyes on what you're doing for movements, and just to learn what's appropriate for you to do and the timeline to recovery. Maybe the surgeon only wants you to do this much until 4 weeks out, and then you can start doing this. But those are really important things because tissues take time to heal. And there's, you see athletes going back to sports sooner and sooner. However, for everyday people that don't have the access to all the spa type treatments that athletes do, our tissues can only heal as fast as they're going to heal. And if you push too soon, in some cases, you can damage tissues even further than pre-op. So it is really, really important. And a lot of places, if you talk to, like for example, at Northside Hospital, we have a financial department. And if you go in there and you show them, hey, I can't work now. I want to get back to work. I can't right now. These are my bills. I can't afford this. I don't have insurance, or my insurance only covers this much. What can we do so I can at least get a couple visits in? In most places, when you do sit down and talk to the financial people, you may get some no's at first, but if you're persistent, you'll typically get some help to at least get in for a couple visits, if not more.
Well, that's great to know. So no matter what hospital or facility that you are going to, talk to someone about your financial situation and see what kind of arrangements can be made so that you can get some treatment. Some treatment is going to go a lot further than none, right?
Right.
So that's a great point to make to our listeners and viewers. Are there any tools or tips that you would like to share that you wish people would know before they started physical therapy?
Well, for most issues, the old saying, if no pain, no gain, is not necessarily true.
Okay.
Don't assume that you should push through things. There are certain things that you do need to push through, but more often that's not the case, and you can actually do more damage. So don't push through pain. Don't push through an injury. You're probably not a teenager anymore, and you can't get away with it. So go see somebody before you do more damage. That's probably number one.
Okay.
Number two is in the meantime, if you're healthy, stay active. Just get into an exercise program. Find something you enjoy to do, whether it's cycling or walking. Or going to the gym. If you hate going to the gym, get outside. If you can't stand being outside, go to the gym. But just find something, because more and more research for any diagnosis shows that the exercise is the key to better quality of life, and especially as you age. The best way to fight aging is exercise. The best way to fight brain deterioration and memory deterioration is exercise, because you're increasing blood flow to your brain. So find something that you enjoy doing that can be as close to exercise as possible, just to stay healthy that way. When I see people come in here after surgery, after an accident, I can tell who was active beforehand, because they recover so much more quickly than people who are not active. So just get active and stay active.
Okay. And that brings me to a question about, you had mentioned earlier pain management.
Mm-hmm.
And I know that I come into contact with a lot of people that are, in pain management. They are dealing with chronic pain, and they're also dealing with extremely limited mobility.
Mm-hmm.
So what would you recommend? I mean, in terms of physical therapy for someone that's dealing with chronic pain, perhaps, they require the use of narcotics to kind of get them through the day. Do you recommend that they engage in some sort of physical therapy?
At least, yes. Even if it's just to find something that they can do for strengthening or managing their pain.
Okay.
Now, one thing that we do have here at Northside, and some therapy clinics have it, some don't, but we do have a pool, and it's a warm pool. And that's a really nice environment for people that have chronic pain. We treat a lot of chronic pain issues in there, because it's warm, you're buoyant, so you don't have the same pressure through your joints. So you're able to move more with a lot less pain. Of course, as soon as you get out, then gravity hits and you hurt again, but it at least gives you some movement. And the hope is that as you get stronger, that pain relief lasts longer. And then again, we teach you what you can do on your own. And it's not hard, so that you can go to a local pool.
Okay.
And continue on and help to manage your pain that way. But even if you don't like water, there are other things. It's a little bit more challenging, but even if some low-level strengthening exercises to help improve your strength at least so you can function better. It may not change your pain a lot, but if you can at least move more or do more without increasing your pain, that's still a win. So it's all about improving. You might not get back to where you were, and you might not get to a 2 out of 10 in pain, but if you can go fish once a month and that's your passion, you might still have pain, but if you can at least get outside and do something that you enjoy doing, then that improves your quality of life.
And you've mentioned the term quality of life several times, which I love. Do you believe that there is a relationship between pain and quality of life?
Oh, yeah. Yeah. I think, pain obviously makes it difficult to move and do things, and it makes it more challenging for people to enjoy what they're doing. Mm-hmm. And then conversely, there's a relationship the other way too. If I can't do what I enjoy, then it becomes more, then I'm thinking about that and I'm more depressed, and then I'm even less likely to be able to do anything. So it goes both ways for sure. Mm-hmm. And that's a challenge. So again, that's where if you can at least get moving a little bit, that gets your mind off of it. It's not going to make it go away.
Right.
It would be great if it did, but chances are it's not. But if you can at least get out and get out of your house, or have a different view, or go meet other people, just to get something new and fresh in your life to at least get your mind off the pain for a while, so that it can't then make you more depressed. Then you can kind of break that cycle, at least temporarily.
Right. And one of the things that you mentioned earlier, in terms of physical therapy, you talked about, just everyday activities, mm-hmm. and helping people to be able to get back to doing some of those things. Do you think that also has an impact on, of course, quality of life, and maybe helping with pain, and or any mental health symptoms that an individual is dealing with?
Sure. Are you talking about just every day in the home, getting around? Right. Well, yeah, because if you have to rely on someone to help you, that's hard. That's hard if you've always been independent. So that does affect your outlook and your mental health for sure. So even, just being able to get up and go to the bathroom, or without help, that's huge. I mean, that's, when I have patients that come back to me and they're like, oh, guess what? I went to the bathroom this weekend. I didn't even have to tell my spouse, and I didn't fall, and it was great. That's a big deal. That's a huge win. And sometimes that's bigger than being able to go out and fish.
Right.
Because, who wants to have to ask for help every time? That's not bad. Not saying that that's bad. If you can do something, you can do something. But, getting in and out of bed, going to the bathroom by yourself, getting dressed by yourself, taking a shower by yourself. Those are all things that you take for granted until you can't. And then those things are really big deals. You just want to be able to do those basic things by yourself. Right. So, being able to progress to where you can perform your activity, we call them ADLs or IADLs, your activities of daily living, without help safely is huge. As far as, feeling good about yourself, and then thinking, okay, I'm able to do that now. So what else can I do?
Right. And are there tools that you all use as part of therapy that can help someone to perform their activities of daily living? Like, if they have problems with reaching, like grabbers and just other things, or with balance and using bars, Are there tools like that you work with to help people
Yeah,
to gain that independence?
absolutely. We have a lot of things in the clinic that we use in the clinic to help people get stronger there. But then we do also advise people to pick up tools like reachers, the grabbers, so they don't have to bend over to pick something up off the floor, or helping you put your pants on. There's sock aids to help you put your socks on, because your feet are a long ways from your hands if you have a spine issue.
Right.
And there's different tools that you can use for showering and bathing and getting in and out of the tub or shower safely. With my amputee support group, that's a big topic, is showering. That's a big process for them, because they have to take a leg off, and they have to be safe with their leg off, and they have to shower and then dry off safely and not move around the bathroom with a wet floor and put their leg on. It's a process. But once you get your process, and there's all kinds of aids. The great thing about these days is that you have YouTube, and there are a lot of people, whether it's amputees or people with Parkinson's or people with spinal issues, spinal cord injuries, or even back pain, have really good videos out there that you can look up to see, how does someone with this shower, or how does someone with this get in and out of a pool, or how does someone with this eat. If I'm missing an arm now, how am I gonna chop my food? There are a lot of tools. There's more and more tools coming out every day, just because there's more awareness. So it's YouTube is actually kind of a good tool to kind of see what some of these are, and people just kind of come up with their own systems to work as well. So it's very individual, based on the impairment. But a lot of what we do in the clinic too is if someone has a hard time, say for example, transferring on and off a toilet, or using a commode or some sort of we practice that in the clinic. And one person might do it one way and that works for them, and someone with a similar situation might have to do it a different way. So it's very individualized, and we practice that and see what works better and safer in their home. And we try to set up something as close to their home environment as possible. So we'll have people take pictures of their bathroom or pictures of their shower, and we kind of try to set it up and work it out that way to see what'll work.
Wonderful. Well, you mentioned support group. So I do want you to share with the audience and tell us information about your support group.
Sure. So I do a support group for people who have sustained amputations, and I do also encourage their family members and their friends to come. And even over the years, I've had people who are considering amputation. For example, if they have an old injury that's just not getting better and they can't function on it, the pain is too great, they're considering amputation, they'll come and talk to amputees and see what their stories are. So that is at our outpatient clinic here at Northside Forsyth in the 2000 building, and it's every third Tuesday at 6 o'clock p.m. And I think the best, if anybody has any questions about that group, it is listed on the amputeecoalition.org website, or they can call the front office and get a hold of me that way here at Northside.
Okay, wonderful. Well, I want to thank you for all that you do to help people to improve their quality of life. And to thank you for being a guest on our show and just sharing your knowledge and sharing tips with our viewers and listeners about physical therapy and the importance of it. Do you have any parting thoughts that you would like to share before we're done?
No, I think you covered everything with your questions. But thank you for having me on here. This was really fun, and I hope it was helpful to somebody. And I've referred a lot of people to you, so
thank you.
You've been very helpful to my patients as well. So thank you.
Well, thank you. And thank you all for joining us today. This has been another episode of the DisabiliTEA, and we look forward to talking with you next time.
You've been listening to the DisabiliTEA with Anjel Burgess. Thank you for your positive reviews, comments, and sharing the show with others. You can catch prior episodes at www.disabilityhelpline.com and on YouTube, Facebook, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more.